Hey, everybody. Welcome back. Welcome back. Welcome back. There used to be a TV show called Welcome Back, Cotter. That was the beginning song was Welcome Back. I won't sing it for anybody because that will get everybody to go offline. So today we've had some great conversations. The SAVE team that's been working on the Green Bandana Project was our last conversation with Autumn and Josie and Brittani. And I understand it was a great conversation, a lot of good detail. They got some feedback from some of our friends that want to talk about that program some more. We also had conversations today with folks from United States Senator Richard Blumenthal's office in Connecticut talking to us about Kids Online Safety Act and folks with the Design It For Us team talking about the role of youth in helping to advocate for safe online experiences. So this week, we've had a lot of chance to talk to a lot of other folks about the work they're doing. And as we kind of come to the end of what has been a pretty remarkable week, we're now going to have an opportunity to talk to the people at SAVE about the work they do. And so we'll kind of go around the horn here and have everybody first start by introducing themselves and kind of talk about what their title is, and then we're going to chat a little bit about the work that we all do, but then I want to have a conversation about why we think the work that we do is important, so that we're not just kind of getting into the bells and whistles of the work that we do. So you have a sense of why any of us get involved with this work, why it's important to us, and why we believe it matters and why we hope it matters. So I'm going to start out with you, Josie. And then we'll just kind of go around the horn.
Yeah, so my name is Josie. I'm the Marketing and Communications Manager here at SAVE. My background is in journalism and recreation management, I guess you would say. And I'm just really motivated by SAVE's mission and some of our more hands-on advocacy work and trainings. I think it's really important that SAVE is so focused on understanding of suicide prevention within communities that aren't just the mental health space and aren't just, that expert level perspective. And so, yeah, I think the outreach and education aspects of what we do are some of the most motivational for me.
Next one up, somebody jump in.
I can go.
Yeah.
Hi, everyone. My name is Jen Owens. I'm the Director of Programs here at SAVE. I've been with the organization just over 10 years now. My undergraduate background was in political science, but after about 8 years in this space, I went back to school for my master's in public health, which I think really positioned me well to really tackle this difficult public health issue head on. My role at SAVE as the Director of Programs is to develop, implement, and evaluate our programs and services. And I'm just really grateful to have an amazing programs team to help me do that.
I can jump in. My name's Autumn Lemieux. I'm the Suicide Prevention Outreach Coordinator, AmeriCorps Vista at SAVE. AmeriCorps Vista is a program that helps nonprofits in a capacity building role for a year. So I got placed here and started in December on the Green Bandana Project, which is a program for high school and college students. I'm really passionate about that program in particular because I had a personal experience in college with the Green Bandana Project. And I really believe in advocating for youth and empowering them to advocate for themselves as well. So it's been great to be a part of SAVE and doing that work.
Am I muted? No?
Nope, you're not
Okay.
muted.
Hi, sorry. My name is Brittani Sensor. My current role at SAVE is Director of Education and Training. I've been working alongside Autumn and Jen and getting the Green Bandana Project up and running. Again, I mean, it's been with SAVE since 2022. However, we've made it better and far more, I guess the word would be to continue the fidelity within the actual expectation of what the Green Bandana is, and we're super excited to update it and bring it to new institutions. My background is in mental health. I am a licensed independent clinical social worker. I started working in suicide prevention in 2019 after I lost my only child to suicide at the age of 13. I've been working with SAVE for the last couple of months on some advocacy programs that are out that we're currently working on, and I'm excited to be a part of the team.
Margaret.
Hi, I'm Margaret Fondell. I'm SAVE's business manager. I've been with SAVE for almost a year now. Really enjoyed working on some of SAVE's operational processes and tools that we have available. Some of the behind the scenes stuff with events, and my background has been working for a nonprofit for almost the past 10 years. So it's been great to find such a wonderful mission driven organization like SAVE. I think it's a great privilege to get to work even on the nuts and bolts of an organization that gets to feel like you're doing something about some of the world's most toughest topics. So I'm happy to be here.
Well, I'm happy that you're all here, and I've been here in this role as executive director for a little over a year. My background is I spent a lot of time, 12-ish years, leading 2 other nonprofit organizations, and it's been a pretty amazing opportunity to be here at SAVE, doing the work that we do, and working with the talent that we have here, everybody who's all very passionate about the work that we do. And so with that, I actually, and again, I'm just going to kind of throw this out. I'm going to let everybody kind of jump into the pool here with their own answers to this question. But everybody kind of has their own reasons for why it is they do what they do professionally, personally, and things like that. And so it would be good, I think, for people who don't see the day-to-day work that we do, to understand why each of us thinks that what we're doing is important, why it's needed, and what's the most important part of it that makes the work fulfilling for you.
I'll just jump in. I think stigma reduction is really important. And I guess coming from a background of communication, I really kind of see the value of what we do in terms of speaking about these things and simply shining a light on the issue of suicide. There's so many communities in which it's just not something you talk about, or it's something that's just heavily avoided. And I think that as we facilitate these conversations and we're engaging with people, whether they're loss survivors or folks who, thankfully haven't been touched so directly by suicide at this point in their lives, having the conversation and educating people and encouraging people to start those conversations in their own communities about mental health and direct correspondence with each other, like reaching out and literally saying the word suicide, asking if someone is okay or if they're thinking of suicide. I think empowering people to have those conversations is a really big grassroots impact.
For me, it's been great to interact with some of the people who have been longtime volunteers or, partnered with SAVE or reached out to SAVE as suicide loss survivors, getting to meet, I think, some of the most determined people and their desire to do something about suicide and, this issue that so many of us face. Like, it's hard not to find somebody who, it's hard to find somebody who's not been impacted by suicide. So just realizing that we have the ability as an organization to, like Josie said, be at a grassroots level and be at a human level with loss survivors too, who also want to be in the space of doing something, and they all have their own unique way of doing it. And being a part of this team, finding ways to connect with the people and give them tools that we have, resources, and spread the reach has been incredibly uplifting for me personally. So.
I'll hop in. I think my most thriving force of why I'm here is to honor my daughter, Aria Joy. At the same time, from a mental health perspective, after losing Aria, there were plenty of populations that I saw that there's a gap between knowing and getting resources. And it was really, really important to me to find a team that worked really hard to bring resources to certain populations that don't necessarily have the opportunity to do one-on-one therapy, or have the opportunity to go to specific grief groups within their community. Not all communities have that, and that has been really, really brought to my attention after doing a lot of research after Aria died. So I'm super excited about SAVE, because I think SAVE just continues to grow and meet people where they're at. And this team works so hard at thinking about every single person who could be impacted by suicide, not just the individual who's struggling with thoughts, but thinking about family members and friends, and how do we meet them where they're at. And I've just continued to be motivated by this group of people, along with my goal to honor my daughter.
So I came to SAVE not necessarily because I was directly impacted by suicide. I have extended family members and a couple of classmates we lost to suicide. I really wanted to work, like Margaret, for a mission-driven organization. And it's really taken me, it took me several years of even working for the organization to admit to myself that I actually do have personal experience with this. I experienced depression for the first time in college. Back in 2011, I didn't have the language or the words. I had to Google my symptoms to even realize that I was experiencing depression for the first time. And I just, through this work, I just want no one to be in that position, to not feel like they even know what's going on. I want to make sure everybody, understands that mental health is important. We have to take care of our mental health. So it was an interesting route for me to get to this organization, but I'm glad I'm here, and kind of echoing what everyone else has said about really the grassroots efforts, especially in the last year with the organization, the hands-on experience with loss survivors and people who have been directly impacted by suicide has just been, really wonderful. And that's what keeps me going in this work.
I see people my age struggle with their mental health a lot, and that's something that I noticed, even throughout middle and high school, and I'm sure that's something that students in middle, high school, and college are noticing now. But one of the things that is different for me now is I have access to resource and I've received education. And when I was younger, not having those things kept me from getting help until I did have those things. So I'm incredibly passionate about our programs and our mission to continue to educate people and offer them resources and get the help that they need. I think that just makes the biggest difference.
Did I miss anybody in this conversation? I think I got everybody, right? So, one of the things, again, what people don't see is the work that each one of you puts into what it is you do every single day. And, we kind of chat about this, is that we punch above our weight here and really do. It's a lot of effort, it's a lot of work. And it's also a lot of work about trying to make sure we get it right. There's 35 years ago when SAVE started, it was one of the few nonprofits in the country that was really focused on the issue of suicide awareness and suicide prevention at a time when people didn't talk about suicide, when the word itself was spoken in hushed tones, and where the stigma around people who lost loved ones to suicide was just overwhelming, and in and of itself helped to contribute to their mental health challenges and their own struggles with depression and things like that. And so people, again, there's a lot of effort here, a lot of work that goes on every single day. And this idea of kind of being at that grassroots level. I mean, for me, and anybody can jump in here with their own comment about it. I mean, I will say that that's what I hope is not necessarily setting us apart, but is more and more becoming kind of our niche, kind of who we are as an organization that, may be based in Minnesota, but is working, across the country in a lot of different ways. But I would like to think, as we continue to grow and expand, that it's really done in this context of being much more accessible and more grassroots with people that need our help.
Yeah, for sure. I see SAVE, really being a pillar in communities to provide resources and support surrounding this, incredibly difficult subject matter.
Yeah, and we talk about our pillars, right? I mean, it's interesting because when we kind of, about a year ago, the team got together and talked about, as we focus on what are those types of things that we want to do as a much more grassroots focused organization, we said we wanted to focus on what we call our 4 pillars: education, training, advocacy, and support for suicide loss survivors. And so, Jen, I'm going to kind of throw this to you, on a programmatic piece of that. What does that mean to you when we talk about kind of being more accessible and more grassroots as it relates to our programs?
It's, providing programs that, that are accessible to, the everyday person. For example, like One Step Ahead. It's a, very broad training, a suicide prevention training. As long as you have access to the internet, you can access this training for free. It's providing resources and trainings for free. Like I said, as long as you have access to the internet, you can access this training to learn about the warning signs of suicide, and learn how to support someone who may be struggling with suicidal ideation. Yeah, that's really kind of what it means to me, just being accessible, being there. Yeah.
I mean, Margaret, you do a lot of connection with, you're in many ways kind of that kind of first point of contact for a lot of people, whether they're suicide loss survivors or folks that are looking for resources. And, what is it that, as people reach out to us, what are the kind of things that they're looking for, either from us or wanting to help us with?
Yeah, I think that a lot of what I've learned about when people reach out to an organization like SAVE is, the first time that they realize how real suicide is for them. And that's in multiple different ways. If it's their own mental health, if it's the mental health of someone they love, or if it's a loss. And I think the nice thing about the resources and the trainings that we've developed is that, they're simple enough, but also broken down. We have these great 1-page documents so that we can be responsive with a core of really good, solid resources that aren't super lengthy. Like One Step Ahead is, no more than an hour. And it helps us be responsive to the public because, each of those points of contact that we get coming, through our email inboxes or on the phone, it's nice to feel like we can still treat them like a human, in that it's not always a form response. A lot of times we're reaching for those same core resources for a lot of different situations, but it's nice to be able to tailor things like they're reaching out about, explaining a suicide loss to children, and we have something for that, or reaching out about a loss that, it's a friend of a friend, and what can they do in this situation? So it's nice to have this base of core resources, but still feel like there's this, we can tailor responses and help them feel empowered. Because I think that's the privilege of getting to work for SAVE, is feeling like you can do something about an incredibly sad and frustrating topic at times. But the hope is in doing something about it. And then when people reach out, they get to be involved in that. And that's like 100 times better to feel like they have, we've even had outreach moments where I've been sending like 50 copies of something to someone because they have other people they want to give it to, not just for them.
Well, and a big change for this organization really, and it's something that was, really driven by conversations that Jen and I had about kind of how do we get these resources in people's hands, and that is to kind of put aside that barrier and obstacle, to make these things free to people, right? So that we can get them out there, we can make them ubiquitous, we can make them accessible to folks. And we're even doing that now with some of our other work, and we'll talk about this a little bit more, things like gun trigger locks, right? We've had the opportunity to partner with some law enforcement agencies, with Veterans Administration, to make these locks accessible to people. And if folks need them, they can reach out to us. And as we get more inventory, we send those out to folks, because those are real impactful kind of physical things that we can share with people, much like our collateral materials, that people can use and they can distribute. And they're actually things that you can use. And to your point, Margaret, it's great to have a 10-page booklet, but if you got to read through all that can be pretty daunting. And if we can accomplish that with a 1-page document and get the point across and the information they need, that's even more impactful. So, one of the other big things that we did is, we redesigned our website. We launched that. That's a process that really never ends. We're still making tweaks there. But the goal and purpose behind that redesign was to make the website more useful, more user-friendly, and we continue to make content changes and additions on that as well. Josie, from a communications perspective, part of all of this doesn't matter unless people know about it, right? It's kind of like if a tree falls in the woods and nobody's there, did it actually fall? So how important from your perspective is our ability to communicate, whether it's events or it's materials, out to the public, to be able to make sure that that's part of the impact that we're trying to create?
Yeah, I mean, people can't make change if they don't know there's change to be made, right? And I think that, between our updated website and our strengthened media partnerships and everything that comes along with that, I think we're really spreading the word of our mission and what we're doing. In particular, I look at like the Kayla's Hope Initiative and our efforts to get structural suicide prevention barriers implemented, not only here in the Twin Cities, but nationwide, as we kind of broaden our scope. And I think we're in an interesting and exciting place with that, identifying how to, communicate about suicide and the issues that directly impact suicide risk and the dangers of suicide, especially when it comes to like, you know, a specific location, things like that. I think we're in a really interesting and exciting place to be communicating about these issues and kind of highlighting problem spots that maybe people weren't even aware of before. I mean, I think until I was in this position, structural suicide prevention barriers weren't really on my radar at all. And, you know, I think it's just important to be spreading the word about all of the different elements, you know, systemic or otherwise, in people's communities that they can be kind of keeping an eye out for, and feeling more empowered and knowledgeable about changing ultimately. Information equals action, you know?
And I love that we've diversified our, you know, messaging so much to reach people on all different platforms and places. You know, people consume their media all different ways now, so many different ways. So it's been really cool to see our outreach efforts really expand.
Yeah, and speaking of that, you know, Josie, you just came back from Las Vegas, where we had a group reach out and talk to us to, you know, share with people what that group is, what they're doing, and how did because again, that was a connection that we made clearly as a part of our communication efforts.
Yeah, so there's a group in Las Vegas that is doing some really awesome work. It's a very, again, kind of to use the word grassroots group of women who started getting together for hikes and other physical activity, basically, but it's turned into much more than that. Organizers were finding that at these events, it was pretty much inherent that, you know, people would start talking about their mental health and the value of gathering together and getting active and being in nature and just finding community and people to talk to about whatever is going on in their lives. And they very kindly selected SAVE as a nonprofit to support during Suicide Prevention Month. So there was a fundraising hike planned. I went out there for it. Unfortunately, it was canceled due to air quality, which was an exciting pivot, but we made it work and everyone kind of scrambled together to secure a space. And there was a great turnout of about 50 women and their supporters, all gathering to learn about what SAVE does, how to prevent suicide in their own communities, connect with resources, and just really exchange ideas and share a really valuable discussion on the topic. And it was just very, very cool. It's amazing what simply gathering and communicating about the subject can do for people. I think it's, you know, it's so valuable just to be able to talk to people about their experiences.
And for folks that don't know, what's the name of the group?
Oh yeah, Vibe Girls Hike Club in Las Vegas.
Las Vegas. So if you're in the Las Vegas area, check them out. Great group of people. And you know, we got an outreach the other day as well, Margaret, from somebody out in California they're doing a marathon, a half marathon. What are they up to?
They're doing the Golden Gate Half Marathon. So shout out to Gare, who's raising funds to benefit SAVE in memory of an uncle and a cousin, and wearing a 40-pound weighted vest for the half marathon to represent the burden that we all carry related to suicide loss, and mental health. So just somebody out there taking it upon themselves to do what they can and reaching out to SAVE. And again, like, it's great to be able to be responsive and say, thank you so much for doing what you can. Let's do what we can to support you in your efforts. So yeah, thanks, Gare.
I mean, that's part of what I got to say, that, you know, in my career in the nonprofit sector, I often talk about, you know, the kindness of strangers, people who reach out to help folks that they never met, will likely never know. And we see that here all the time, right? We see that, some of the folks that are watching here who are with this group called Save and Raid, who've been doing this event on Save's behalf for a number of years all across the world, really. Folks that, just, again, feel so strongly about the mission, feel so strongly about the purpose that they want to help give back. And they give back to people, again, that they're never going to meet, will never get to know. But what's important for them is that they know what they're doing is making an impact and helping others. And that's, again, literally for me is one of the best parts of this work that we do, is finding those folks that kind of reach out from places you wouldn't expect and say, I want to help, I want to make a difference. How can I make an impact? And whether it's hiking or it's running or it's doing a streaming event, or even this Sunday, I'm going to a racetrack a couple hours from here, where there's the racetrack is doing Race for Suicide Awareness on Sunday. And it's an opportunity for them, in front of 500 people during a car race, to talk about suicide and how everybody has a role to play in helping to raise awareness and to help prevent suicide. Brittani, I'm going to throw you on the spot here a little bit, because, obviously your connection to Save, kind of in a lot of ways, at least with the modern day Save, I will say, started when you started working on Kayla's Hope with MJ Weiss to talk about how we could help protect others from suicide on public structures with suicide prevention barriers and deterrence. As someone who is a suicide loss survivor, how important are organizations like Save, and not just Save, but again, there's a lot of organizations out there doing important work out there, but how important are these organizations for you and for others who have experienced a loss to suicide?
Yeah, great question. Every single loss survivor's experience is different. And it's important that having someone to talk to, or different options and different resources, is pivotal to that community aspect. There are a lot of feelings, and there's a lot of guilt and sometimes shame and fear and judgment that comes with suicide. And being a part of an organization where there are people fighting for you, and not just for you, but for your loved one, it creates that hope. And that's why I love the term Kayla's Hope, is because we all need something to hope for and be excited about. And after we lose someone that is so close to us in such a tragic way, we're looking for something, at least in my experience, right? We're looking for something to make sure that no one else has to experience that, or put guardrails in a certain space so that it's obsolete. It's not going to happen to someone else, or creating something like the Green Bandana Project so that students have resources. Finding a community where people see the need is monumental to how we grieve. And creating these relationships and showing up and having a space like Save that's willing to meet loss survivors where they're at and say, hey, you're not alone. I'm willing to fight with you on this particular issue, is one, not just helping the community, but is also helping each survivor, right? In how they continue to honor their loved one, and giving them that hope so that they can continue to move along in honor of the person that they love that they lost. So it's an incredible partnership, and you're right. There's tons of people that are tons of different organizations that are working on those relationships and issues that affect suicide survivors on a daily basis. But for me in particular, things that are really important to me are youth suicide prevention, right? So the Green Bandana Project was something that was very, very important to me to be a part of. Learning about Kayla's Hope, those structures, those tangible steps that we can take as individuals, that every single person can do, is a lot easier than this ambiguous, oh, I can help save lives. What I love about SAVE is they're tangible efforts that people can be a part of to help people who are struggling.
It's interesting because throughout this week, again, we've had a chance to talk to a lot of different groups, a lot of organizations that are out there doing really important work. We talked to Deb Stone, who is, with the Centers for Disease Control, who helped to lead the creation of the most recent 10-year national strategy for suicide prevention. I had a conversation today with the person who's with a group called Farmer Angel Network that is reaching out to farmers in the ag community to help deal with, that kind of public health crises that's really starting to emerge in rural communities. We've talked to folks about veteran suicide prevention, 988 on tribal lands, and we've got a couple more conversations today. One about the impact of suicide on the disabled community, and what are the unique needs and resources that community needs to deal with, both mental health challenges and suicide. And then we kind of end the day with a conversation with one of the people who helped to kind of create and expand 988 here in the country. And so, for each of us who are involved in this work, and as all of us collectively as a team, as we think about the future and we think about the kind of things we want to be able to continue to do as an organization, what are the kind of things, if you were to say, this is what I want people to think about SAVE, in the next year or two, in the next 5 years, what do I want us to be known for? What do I want us to be able to say we're doing in this space? I'd love to hear your thoughts on it, because again, obviously, what we do together has to be something that we can all kind of speak with one voice on and be able to work together on. So I'm curious what you all think, kind of what we should be. If somebody said, what are you going to be when you grow up? What's SAVE going to be when we grow up?
I would say, kind of piggybacking off something that Margaret touched on earlier is, I want people who interact with SAVE, anyone at SAVE, well, first of all, to have a pleasant interaction. And then second, just I want us to continue to work toward programs and services that are having that direct impact, an impact that we can show. And, people would report, this really helped me. And I think this is an amazing question for the public. If you've experienced a suicide loss, what types of resources or services were you looking for? Where were there gaps? SAVE wants to help fill that. We, when we develop a new program or service here at SAVE, we look to you, we look to the public to ask, what are the gaps that we're missing? Kind of, we're in this bubble. But back to the original question, definitely an organization that continues to move the needle with that direct impact.
Anybody can jump in on this question.
Yeah, I would say just bolstering our very tangible efforts, whether that's, gun lock distribution or, the erection of more structural suicide prevention barriers in our communities, or, protections for youth on social media, all of those very, just very practical approaches to this problem, and then just also continuing to make suicide a point of conversation, continue, educating media partners about how they can better report on the subject matter, how they can kind of inform their audience about the resources that are available to them. But yeah, I would say just being as tangible in our impact as possible, whether that's, connecting survivors to, financial support or whatever they need after the fact, figuring out ways that we can be agile and flexible and, improving in our ways of making a literal impact in this space.
Anybody else have like a profound vision of what we're going to all get together in November? We're going to spend a long time having this conversation about kind of review the year behind us, right? We had some goals and objectives in 2024, right? We wanted to get so many folks to take one step ahead or some form of a gatekeeper training, if you will, for suicide prevention, to get the knowledge that they need to have a conversation with somebody about suicide. And if they tell you that they're thinking about suicide, what do you do with that? We had some ideas and vision for how we wanted to be involved in advocacy. So whether it's the work that Jen's doing representing SAVE with the Mental Health Legislative Network, making sure that we're creating collaboration and partnership with other organizations that are out there in this space. I will say that, I think we've worked deliberately and intentionally to really reach out to other folks across the country who are doing work and saying, what can we do to help amplify what you're doing? Make sure they know what it is that we're doing so that they can help share the impact that we're trying to make. And so, I think just the opportunity to continue to keep this focus on how do we make ourselves accessible, how do we make sure that we're making a direct impact. I think that's really exciting because that there is so much runway for us to travel in that space, that also underscores just how desperately having that kind of perspective is needed right now.
Yeah,
So go ahead.
sorry.
Go ahead.
Just in the same vein, I think about the kinds of partnerships and collaborations we're building, but also the people who reach out to us and, point out to us a need, a gap, or, give us a question we've never heard before are amazing. I think a goal for SAVE that I have in mind feels like, anybody feeling like they have a question worth asking or a thing worth doing, just saying, oh, somebody's out there running a half marathon with a 40-pound weighted vest on feels extraordinary, but that we continue to make ourselves so accessible so that if somebody even has 5 minutes that they feel like it's worth asking their question or reaching out, that it doesn't just have to, you don't have to feel like it's as extraordinary as that, because any reach out, I think, on this topic is extraordinary and brave and takes a lot of determination. So making it feel like that's obvious and intentional to everybody who, comes across us even at a glance.
And I'll just add, if you reach out and it's something, we don't do or we can't provide, I mean, our goal isn't just to say, well, good luck. I mean, I think each of us does this every day. You know, if we don't have an answer, we find an answer for you and we respond. So being really that heartfelt, responsive organization, I think we are already doing that, but just to make sure to continue to do that into the future.
Yeah. Great, Jen. And I will piggyback on that. Is my goal for SAVE is to continue to think outside of the box of what suicide prevention has looked like in the past, and really take the research that we are getting and conversations that we're having with survivors and with schools and with certain employee networks, right? And figure out how to meet them where they're at. Maybe it looks different per space, right? And finding ways to continue to grow what prevention looks like.
And I'll add again, because every time someone talks, it triggers something in my brain. But also, you know, do more around health equity. It was a big part of the national strategy. As SAVE meets in November, I'm excited to talk with the team about, you know, really tangible, easy ways that we can be building culture and a diversity and meeting different communities that are not only just here in the Twin Cities, but across the country. And sometimes that sounded, you know, to me scary and difficult and a lot of translation, things like that. But it's not, it doesn't have to be. And I learned that recently. So I'm just really excited to continue to move SAVE, you know, in that direction as well. And, you know, really prioritize health equity.
Yeah, you know, and I will say, you know, we're mindful of that, mindful of the fact that there's more work that our organization needs to do in that space. There are areas that we're working on to try to recognize that health equity requires all sorts of different approaches, including, you know, what does the composition of your board of directors look like? And I think, you know, as we look at our board composition today and what we're doing to kind of build out a board that reflects the community that we're trying to serve, I think that's really important. I think working with organizations that are out there focused on equity, again, extraordinarily important. You know, there's a lot of folks out there, again, doing really important work in that equity space. We're going to learn from that. We're going to take some of those learnings and we're going to make sure that those get connected with what we're trying to do, to make sure that when we have that conversation, we can look at it through that equity lens and make sure that we're recognizing that, you know, we have a role to play in that space. And you know, and Brittani, you made a comment that I think is important for me as I think about SAVE as we move forward. And that is that idea of kind of challenging the status quo, if you will, right? It's that notion of not being afraid to be positively disruptive. You know, I think there's an opportunity for us as we look at some of the work that we're doing and some of the work that we want to do, that we've had conversations about what can we do differently that maybe is not being done to support suicide loss survivors who are struggling economically and financially. Where can we play a role with that? Where can we play a role in kind of more direct service and support of suicide loss survivors? And what does that look like? And that's part of what I like about working with each of you, is that there's always a different idea and a different perspective and a willingness to say, maybe we need to look at it this way. Maybe we could try doing it this way. Because I think in that space, ultimately, that's where change and progress ultimately happens. And plus, it'd be really boring if none of you were creative, innovative thinkers who were willing to challenge the status quo. So,
And this team is not boring. Definitely not boring.
no, there's nothing boring about any of you, that's for sure. And and that's part of what I look forward to when we have conversations, is that people are willing to challenge conventional wisdom. They're willing to challenge me, willing to challenge, how we may approach something and may look at something. And I will tell you that any organization I've ever been involved with, where the biggest impact comes from, is for people to feel as though they have the freedom and the opportunity to offer disruptive ideas or be willing to push back on what people consider to be conventional wisdom. So we're going to kind of start wrapping this conversation up a little bit. One thing I want to mention, we haven't done a lot of this week, but we do have a generous donor who has said that they're willing to make a donation of up to $10,000 to SAVE, so that every dollar you donate at save.kindful.com gets matched dollar for dollar. So if you give $1, we get $2. If you give 5, we get 10. If you give 10,000, we get 20,000. If you get 1 million, we get 1,020,000. I think that's how it works. I'm not exactly sure. Is that what it would be? My math is really bad on that one. So if that's something, you've got the opportunity to make a donation of any amount. And I will say we have a lot of really good supportive donors who support this organization's mission. We're grateful for that. And it'd be great if we could hit this match and before the end of the month, in September. So we're doing our best to try to make that happen. One of the things all week in these conversations, I've asked everybody who's been a part of the conversations, with few exceptions, as we kind of wrap up the conversation, what is a positive message of hope that you want to share with somebody, whether it's folks that are watching this or people that you interact with? The entire theme of this week has been help, heal, and hope. So as we kind of round this conversation out and begin to get closer to ending out the week, I'd love to hear from each of you. What's a hopeful message that you want to share with people as we kind of bring this conversation to an end?
I'll just say, I know it's so cliche, but you're not alone. I mean, especially in this day and age, there's resources and support groups and for almost everything. Not just suicide or mental health. Life is full of adversity of all different varieties. And I can almost guarantee that someone else is having, a similar experience. So don't be afraid to reach out. There's no shame in getting help. Plug for 988 if you're looking for mental health, substance abuse, suicide prevention resources. Not just those, they can help provide access to all kinds of different resources through 988. So please reach out. You're not alone.
Yeah, I'll
Yeah.
piggyback on that. Oh, sorry, Josie.
No, Brittani, you go.
This week, I've been reminded in many ways that suicide is preventable. I mean, we all can do our part in meeting people where they're at. Learn about how to have conversations about suicide. Learn about coping skills and learn about how to how to better help yourself with your physical health, your mental health, your emotional health. They all play a role in how we show up every single day, and it's okay to take a day off and make sure you're taking care of yourself, be an advocate for yourself, and ask and do what you need to do to make sure that your emotional and your mental health is taken care of. I will also say to the survivors, because there's a term called It's Okay to Not Be Okay. Also, I want to say to survivors, it's okay to be okay too. The words, it's okay to not be okay, don't resonate with me. And after talking to a lot of survivors, it doesn't really resonate with them either. And it's okay to be okay, survivors, and it's okay to move on move forward, excuse me, and continue to work on yourself and help others. I will leave with that.
Yeah, I would say too, to add to the whole suicide is preventable notion, it absolutely is. And there are so many factors that contribute to the issue of suicide from a public health perspective, whether that's environmental or financial or community wise. There's a loneliness epidemic in this country, for example. I mean, I think that being said, there are just so many different ways to approach the solution and approach preventing it, just as individuals. And so I think there is no real limit to what you as one single person can identify as the way that you're going to look out for the people in your life and connect with them. And again, I think just knowledge is power as you navigate your relationships and the communities that you're involved with. Just be mindful that suicide is a thing, it's a risk, and we can all do our part to just keep an eye out for those warning signs and give people a hand when we see them. And also just plugging One Step Ahead, save.org/one step ahead. 40 minutes, that's all it takes.
I agree wholeheartedly with what's been said so far about the facet of different ways. I think that's one of the main things that gives me hope, is that there's nothing to do. There's plenty of things we can do. There's never not work that can be done. And so it means not getting paralyzed by feeling like this is an insurmountable issue, because it's not. And thinking about all the ways that people not only do something to help prevent suicide, but do something to support people who have lost someone to suicide or to grieve their own person. Just thinking of the family I talked to this week who are eating chicken fried steak in memory of their person this weekend. And that, by doing that publicly and talking about their person that they lost with loving memory, they're showing that that's, an absolute right that they have to remember and grieve in their own way. And it's just, there's countless stories like that. So that's, given me a lot of hope to meet so many people who remember and remember joyfully.
Kind of adding on to what you were saying, Margaret, it gives me so much hope to just see the community that so many people, hold and bring together, and just that impact that makes. I think, like Josie said, a lot of what people seem to be experiencing is a loneliness epidemic, and just seeing the strength of those communities and the impact that, every single small action makes is so inspiring to me, and gives me a lot of hope.
Yeah, it's, as I listen to each one of you, it's you kind of emphasize each one of the things that you said. We had a conversation this week with a board member, Mike Erickson, who lost his son Luke to suicide, who is a facilitator with a grief support group. And one of the comments he made was, and Brittani, it kind of goes to your point, which is, it's okay to be okay. It's okay to get to a place as a suicide loss survivor where you can laugh again, where life, it has meaning and has purpose. Everybody grieves differently. We used to talk about the stages of grief as though they kind of worked in some kind of, straight line, and they don't. Not everybody grieves the same way. Not everybody goes through each stage of grief. Phil and Kevin Klusner, who lost their sister Amy and their brother Mike to suicide, talked about that as well, saying, their grief, was processed differently than other people they know. Bob and Lynn Pofrell, same thing, who lost their son Tim to suicide, talk about how they kind of had to process and continue to process that grief. And it doesn't all happen in one straight line. And it's okay to not be okay, but it sure as hell is okay to be okay as well. So that's an important message for people to know. It's also an important message to know, again, nobody here is alone. There's resources out there, 988, call it, text it, get on chat. It's confidential, it's free, 24/7, 365. There are people on there that are trained to help you. If you're somebody who has somebody who needs help and you're not quite sure what to do, call or text or chat 988. You can talk to those folks, and on the other end of that conversation, they'll be able to give you ideas on local resources that can help you help someone else. And at the end of the day, that's what we're all trying to do. Each one of us has the ability to save a life. Each one of us has the ability to make an impact in somebody else's life by giving them meaning and purpose and letting them know that we're all in this together. And so I am grateful to be in all this together with each of you at SAVE. Proud to be a part of this team, proud of the work that each one of you are doing. And I know that we will continue to focus our best efforts on doing all we can to help save lives and help to make sure that we can help heal and bring hope to people. With that, thanks for watching. We'll see you all around later.